Healthcare innovation, a lifesaver or a divider? Today we're exploring how cutting-edge health tech might actually be widening the gap between large aged care providers and small, often standalone homes, leaving some consumers behind.
Oh, that's an intriguing perspective. I've always thought of health technology advancements as universally beneficial. What's causing this divide?
Imagine two realities within the same system: bustling innovation hubs where cutting edge tech seamlessly integrates into care, and forgotten outposts where staff are stretched thin, struggling with outdated tools. This isn't just a technological gap, it's a widening chasm impacting the very people we're meant to care for, leaving some behind in the digital dust.
Hmm, I can see how that would be a problem. Do we have any data on how widespread this issue is?
Unfortunately, we don't have specific statistics, but we do know it's a significant problem. Think about it this way: large providers can afford teams of analysts, innovation centers, and have the bargaining power to secure the best deals on new technology. They can negotiate volume discounts and preferential terms. On the flip side, smaller providers are often operating on shoestring budgets, juggling patient care with administrative burdens.
That's a stark contrast. So, what happens when these smaller providers can't keep up with the latest innovations?
This is where serious concerns arise within aged care. It's not about having the flashiest new gadgets. This technological divide has tangible repercussions for the well being of our elderly. Consider a scenario where one aged care facility struggles to implement basic remote monitoring of vital signs or solutions to prevent falls, while another has seamless access to these tools. This disparity means residents in the less equipped facility might face a higher risk of undetected health issues or preventable accidents simply because the home lacks the resources or expertise to utilize available technologies effectively.
Uh, that's a troubling thought. It seems like this could create a two-tiered aged care system.
Exactly. And that's why this story caught my attention. I'm a health tech expert who's been grappling with this issue for over a decade, and I've decided to take matters into my own hands. I've developed a project called SMPLS Assist, which aims to bridge this technological divide.
SMPLS Assist? What's that all about?
It's essentially a support system for smaller healthcare and aged care providers. The idea is to give these providers access to the same level of expertise and resources that larger networks enjoy. They're offering everything from help with technology selection and price negotiation to implementation support and staff training.
That sounds ambitious. How exactly does it work?
Well, from what we've learned, it's a highly collaborative process. We are not just swooping in with prepackaged solutions. Instead, we're reaching out directly to healthcare providers, asking about their specific challenges and needs. The goal is to co design solutions that truly fit each provider's unique situation.
Hmm, that's an interesting approach. It's not often you hear about tech solutions being built from the ground up like this, especially in healthcare.
You're right. And I think that's part of what makes this story so compelling. It's not just about the technology itself, but about reimagining how we approach healthcare innovation. We are talking about proactively sourcing innovative solutions from across the globe, exploring the very best the global market has to offer without being beholden to any specific vendor or preconceived notion.
So, if we had only known the extent of this problem earlier, could we have prevented this divide from growing so wide?
That's a great question. It's hard to say for sure, but I think recognizing the issue is the first step towards solving it. As a creator of SMPLS Assist, I see this as a matter of equity, ensuring that every patient has access to high quality care, regardless of where they live or which clinic they visit.
It's certainly a noble goal. I have to wonder, what's the catch? This level of support can't come cheap.
You know, that's one of the big questions we have too. Unfortunately, we don't have a clear answer on the financial model. The focus seems to be more on the potential impact than on the business aspects. But you're right, it's an important consideration.
Well, even if there are costs involved, if SMPLS Assist can truly level the playing field, it might be worth it for many providers.
Absolutely. And it's worth noting that there's a strong emphasis on finding solutions that are financially sustainable for these smaller providers. They seem to understand that any solution has to make economic sense.
So, what's next for SMPLS Assist? It sounds like they're still in the early stages.
You're right, it does seem to be a work in progress. There's an active call for healthcare providers to reach out and get involved. We want to hear directly from providers about their challenges and needs.
That's an interesting approach. But how do they plan to maintain objectivity in their recommendations?
That's a key part of my approach. By not being tied to any specific vendors, we aim to maintain complete objectivity and focus solely on finding the right technological fit for each organization. It's not about pushing the most readily available or heavily marketed option, but about finding the best solution for each specific case.
I can see how that would be valuable for smaller providers who might not have the resources to do that kind of extensive market research themselves.
Exactly, and it goes beyond just selecting the technology. SMPLS Assist is also offering to conduct thorough due diligence on behalf of these providers. That means delving deep into the technical specifications, evaluating the vendor's track record, and ensuring they are not just buying into hype, but investing in real impactful technology with proven results.
That's quite comprehensive. But what about after the technology is purchased? That's often where things fall apart, isn't it?
You're absolutely right. That's why SMPLS Assist's commitment extends far beyond the initial purchase. They are promising to provide crucial clinical and technical support for a successful and sustainable rollout. This includes help with integration processes, comprehensive training for staff, and ongoing support to ensure providers continue to get maximum value from their investment over the long term.
It certainly gives you hope that maybe we can start to close some of these gaps in our healthcare system. But I have to say, I'm curious to see how it all plays out in practice.
Absolutely. There are still a lot of questions to be answered. How will they measure success? What kind of adoption rates can they achieve? And perhaps, most importantly, will it actually lead to better patient outcomes?
Those are all great points. It's one thing to have a vision, but executing it in the complex world of healthcare is another matter entirely.
Exactly. But regardless of how SMPLSSCs ultimately fares, I think this story highlights a critical issue in our healthcare system. The tech divide between large and small providers is real, and it has tangible impacts on patient care.
Agreed. And it's not just a matter of fairness or competition. When smaller clinics and rural hospitals can't access the latest innovations, it's patients who ultimately suffer.
That's the bottom line, isn't it? At the end of the day, this is about ensuring that every patient, regardless of where they live or which clinic they visit, has access to the best possible care. It's about leveling the playing field so that innovation isn't just a luxury for the largest healthcare providers, but a reality for all.
It's a lofty goal, but certainly one worth pursuing. And who knows? Maybe initiatives like SMPLS Assist will help pave the way for a more equitable healthcare future.
Only time will tell, but one thing's for sure. This is a story we'll be keeping a close eye on. The intersection of technology, healthcare, and equity is only going to become more important in the years to come. And it's not just about the technology itself, but about reimagining how we approach healthcare innovation as a whole.
Well, I think we can all agree that's a goal worth pursuing. It'll be fascinating to see how this story unfolds.
Absolutely. And on that note, I think it's time we wrap up. Thanks for joining us on this podcast where we bring you the stories that matter. Well, until next time, keep questioning, keep exploring, and keep caring about the world around you. Please visit our website on www.samplsss.com for more information and book a meeting to discuss your needs.
Couldn't have said it better myself. Thanks for listening, everyone. We'll catch you on the next episode of our podcast.